Hello and welcome. My name is Professor Peter Nash from School of Medicine at Griffith University in beautiful downtown Brisbane, Australia. And I'm talking about a window of opportunity in psoriatic arthritis. There's only been one real study that's looked at this carefully from Mohammed Haroon in Dublin that showed there was a window of opportunity where people would do worse functionally, the possibility of drug-free remission, etc. is about 6 months. So this is a Dutch cohort of 855 patients. They had new diagnosis of psoriatic arthritis. These people were DMARD naive, and they looked at the total delay of getting diagnosed and treated. They looked at whether it was related to the patient, and they found that was quite short, about 4 weeks. They looked at whether it was a GP delay, and really that was quite short as well. It was about 18 weeks because the median delay for the whole cohort was about 42 weeks to get diagnosed. So they split them into those patients who had diagnosis delay of less than 12 weeks, between 12 and 52 weeks, and greater than 52 weeks. And they showed quite clearly and significantly that if your delay was over 52 weeks, you had significantly less chance of getting into minimal disease activity, significantly less chance of getting DAPS or low disease or remission, and significantly worse HAC over time. There was no difference in X-ray progression, and although numerically better, there was not a big difference between 12 and 52 weeks, which is a little disappointing, but clearly over 52 weeks is bad news. And I'm sure that the real problem is that a lot of these patients, even though this study didn't show it, they live in general practice where the penny never drops between the joint symptoms and the presence of psoriasis. So these patients are considered to have osteoarthritis and just treated with an anti-inflammatory. Why? ESR normal, CRP normal, rheumatoid factor negative, maybe a bit of nodal OA. They're written off as having osteoarthritis and just given an NSAID. The number of these patients who have a painful swollen knee that gets an unnecessary arthroscopy, the number of patients who have forefoot inflammation and have unnecessary Morton neuroma surgery. So this is an educational opportunity at general practice, and we need to think about timely referral and cut down any delay to get people appropriately diagnosed and treated. Doesn't always mean they have to have very expensive biological treatment because there's no difference in X-ray progression, but clearly they need to have their pain, their fatigue, their symptoms, their quality of life improved by appropriate treatment. Thank you very much for your attention.